Hi there, Dr. Kristina Tansavatdi here. So in this video, I'm going to be sharing with you the information for your upcoming fat transfer procedure. Here are the post-operative instructions I like to highlight. So you will have already received the paperwork, and in it, the first line is talking about what we do for the small incisions in your face. For introducing the fat, I like to use a needle to put in the blunt cannula. So there will be some small pokes. It could be just in your cheeks, or it might be in your temples if we've done the temples, or in the lower face right under the jawline. So those are the typical spots. You'll see the spots, or you might feel the spots. And if those are those areas, we've already put ointment before you left, but when you get home, those are the areas we're going to continue putting Aquaphor or bacitracin ointment to those incision sites, the small little pinpoint marks, and that's going to be 3 times a day to keep it moist. Those holes have to close up, and usually it takes about 3 to 5 days, but it may take longer, so do it for the full week. In addition, there's going to be swelling that may be, somewhat presentable the first day, and it will get worse over the 2nd to 3rd day after the procedure, and maybe even the 4th day. You're going to want to use cold compresses, not ice cold. So my trick, what I tell most of my patients is, go ahead and take a washcloth, get it wet, put it in the freezer so they're ready for the procedure, after your procedure. And then when you're ready, you pull them out and you crack them and get them all loose. And it'll be nice and cold, but it won't get so warm so quickly. So they'll be able to last about 10 minutes. That's about the time you want. You put it on for 10 minutes, and it's once an hour, or if you can do more frequently, it would be 10 minutes on, 10 minutes off, 10 minutes on, 10 minutes off. And then when it's time to go to bed, though, you don't need to continue through the night, because I'd rather want you to sleep and heal. So it's just while you're awake that you're going to be doing the cold compresses. The last thing you want to know is that the fat is going to take some time to resorb. Some of it's going to resorb. And during that time, you don't want the fat to go away too quickly. So we don't want you to be so active right away. The first 2 weeks, you want to avoid excessive activity. We don't want you doing a lot of cardio sports, anything that's going to burn and melt that fat. And you don't want to be massaging the site in the first 2 weeks, because we want the fat where we've placed it to stay where we've placed the injection. So you're going to want to avoid massaging those areas. Cold compress is all you need, and we expect for the swelling to linger after the 2-week mark, slowly, gradually go down to its final result, which can be between 6 weeks and 3 months. Also, the thing that you want to know is washing your face and your hair the next day is possible for this procedure. Washing your hair daily after the procedure with a gentle shampoo and cleanser is what we recommend. You'll want to eat soft foods, because when you chew, you might find that it's kind of numb or stiff, or that your cheeks are so full so that when you try to chew, it could be a little bit discomfort from that procedure. And then talking should be minimized after this procedure, and you want to sleep on your back with your head elevated the first 3 nights. After that, you can sleep flat, preferably on your back, because if you sleep on your sides, you'll get swelling that kind of settles on one side more than the other. So those are things to know. Then there's going to be general post-operative instructions. That's going to be covered probably in another video. You can find those in our YouTube channel. There's one specifically for just the general post-operative instructions. And there you have it. Those are the instructions for fat grafting and what to do after your surgery. Thank you for tuning in.